Hello everyone, welcome to Surgery and Anesthesia. So today I am going to teach you a spinal anesthesia procedure for an obese patient, and I am going to give a spinal anesthesia for an obese patient here in the C-section procedure. Now let's start the procedure. I have already opened the spinal sheet and now I am wearing the gloves. Make sure it's sterile. Don't touch anywhere in an unsterile area. Ask someone to put betadine solution for cleaning the skin. I'm using a 10% betadine solution to clean the skin. Clean the skin properly. The cleaning should be inside to outside. Clean it twice at least. Let the betadine dry for a while. You can leave it for 1 minute. Now put on the eye towel. Now ask someone to put spirit over there. Injecting the drug or the needle where there is already a betadine is present. It's quite dangerous. It can cause chemical meningitis. So make sure everything is clean before you start to inject the drug or before you start to inject the needle. I have already loaded the drug. It's a 0.5% hyperbaric bupivacaine solution, and for the C-section I am using a 2.2 ml. Now let's wipe the skin. Now palpate the lumbar space. Make sure you are in L3, L4 or L4, L5 space. I am using a L4, L5. I am introducing the needle slowly. I think I should go a little more inside. Here we go. Got the CSF. Can you see the CSF now? Yeah. Now connect the syringe with the drug. Aspirate it slowly and inject the drug. Go slowly. Now aspirate it more and inject all the drug. It's done now. Thank you so much for watching.